I washed my hands and I've donned on all necessary PPE for the assessment. My name's Angeline and I'm going to be your student nurse. I'm going to be performing a physical assessment, and I would then ensure privacy by closing the door, drawing the curtains, and I'm now going to verify the patient's ID band. Can you please state your name and date of birth?
Boyan Swarovski, August 15th, 1992.
Okay, and do you know where you are?
Hospital.
Okay, and do you know why you're here?
Physical.
Okay, and what year is it?
2020.
All right, and how is your mood today? Okay, so the patient is A&O times 4 and has a pleasant effect. I'm also noting the patient's hygiene, which is appropriate. Color of the skin is appropriate to race. I noticed the patient's posture is upright and they had a even gait when they walked in. I'm then going to begin by inspecting the upper extremities. So I'm just going to look and compare both arms. They're symmetrical. I am looking for any deformities, no scars or lesions. The skin is intact. I'm going to palpate, so let me know if you have any pain.
No.
Okay, and then I'm going to palpate again, but for temperature. And I'm noting that the temperature is even within normal limits, bilateral. And now I'm going to palpate the epitrochlear nodes, which should not be felt, and they are not present. I am then going to palpate the brachial pulse, which is +2 regular and equal bilateral. I'm then going to go to the radial pulse, which is +2 regular and equal bilateral. I'm then going to inspect the hands. There is no excess moisture, no scars, lesions, and color is still appropriate. I am going to assess the capillary refill. The capillary refill is less than 3 seconds. I am then going to test for fingernail clubbing. Can you please do this? Okay, so there's no fingernail clubbing. And now I am going to start with the posterior chest. So if you could just turn around. Okay, so I'm noting the scapulary placement, which is symmetrical on both sides. The spine is midline. The color is still appropriate to race, and there are no scars, lesions. I see no dyspnea or uneven respirations. I'm going to palpate the patient's back, so just let me know if you have any pain.
No.
Okay. I'm then going to palpate for phrenesis, so can you just repeat 99 after I move my hands?
99, 99, 99.
Okay, so vibrations were felt, they were equal bilateral. I'm then going to palpate for thoracic expansion, so take a big deep breath in. Okay, thoracic expansion was symmetrical. And then I'm going to percuss the costovertebral angle for any tenderness. Do you have any tenderness?
No.
Okay. Any
No.
tenderness? All right. Now I'm going to listen to some breath sounds. So if you could just take a deep breath every time I move my stethoscope with your mouth open. I'm also going to listen to the lateral sounds of the chest wall. Breathe in. Okay, and again. And the other side. Breath. And one more time. Okay, so the posterior and lateral breath sounds were clear to auscultation. And now I'm going to ask the patient to turn around and I'm gonna assess the anterior portion of the chest. Okay. So again, I'm observing the patient. There's no labored breathing, respirations look equal, and I am noting the skin color, which is still appropriate. There is no scars, lesions, or predominant pulses that I can see. And I'm going to begin by palpating for phremesis. If you can just repeat 99 again.
99, 99, 99.
Okay, and vibrations were felt equal bilateral. I am then going to listen for breath sounds. So if you could just take a deep breath in with your mouth open again. Okay, so breath sounds were equal and bilateral. They were clear to auscultation. And now you could just breathe normally. I'm gonna listen to your heart sounds. So we're gonna start at the aortic. We're gonna move to the pulmonic, Erb's point, tricuspis, and then mitral. I'm also going to listen to the apical rate for 1 minute. Okay, so your apical rate was 82 beats per minute and it was regular. There was presence of S1 and S2, no presence of S3 or S4, and there was no indications of any murmurs, rubs, gallops, or clicks. And now if you can lay down, I'm just gonna assess your abdomen. Okay, so if you could just pull up your shirt. All right, so I'm inspecting the abdomen. There is no predominant pulses. The navel is midline. The abdomen is flat. The abdominal contour is flat. And I'm also inspecting for any scars or lesions, deformities, and any signs of masses or bulges. I'm going to auscultate first, and I'm going to listen to bowel sounds in all 4 quadrants. So there was bowel sounds that were heard in all 4 quadrants, and I was using the diaphragm of my stethoscope. Now I'm going to switch to the bell, and I'm going to listen to see if I can hear any vascular sounds. And we're starting with the aortic. And then we're going to do the renal on both sides. The iliac. And there was no presence of any bruise that I heard. Now we're going to begin by palpating. I'm going to note any tenderness, masses, or bulges that I feel, and guarding of the abdomen from the patient. So just let me know if you have any tenderness.
No.
Okay. Also noting guarding of the patient's face. There is no tenderness. I would deeply palpate 4 centimeters for any masses, bulges, again, guarding and tenderness of the abdomen, which is not present. I would then palpate for inguinal lymph nodes, femoral pulses, and any indication of hernia. And now I'm going to assess the lower extremities, so you can pull down your shirt. And I'm inspecting the lower extremities for any vascular deformities, even hair distribution, and skin color is still appropriate and even. I'm going to palpate for any tenderness, so let me know if you have any pain.
No.
Okay, I'm then gonna palpate for temperature. And temperature is within normal limits. It is 1 to touch and equal bilateral on both sides of the legs. I am then going to palpate for any pitting edema, which is not present. I'm going to check my posterior tibial pulses. They are +2 regular, they're present, equal bilateral. And then I'm going to go to the dorsalis pedal pulse, and they are +2 regular and equal bilateral. And then I'm going to assess for capillary refill, which is less than 3 seconds on both feet. And that concludes the midterm assessment.